Hello and welcome to Effortless Mastery. Today we'll be learning on Introduction to Gross Anatomy. You could ask some questions. Why is this important? This video is designed specially for students that are having struggles with anatomy. This is like the basic foundation which every student must know, either before studying anatomy or before understanding the concept of anatomy, whether you're a medical student, a nursing student, or whatever department you are in. As far as you're dealing with anatomy, you must understand this topic. Now, so for introduction to anatomy, I would like to start with what is anatomy. Anatomy is just broadly study of structures. In simple words, study of structures. That's what anatomy is all about. But then anatomy has like three major branches where we can learn about the structures of the human body at a macroscopic level. Macroscopic here is what you can see with the naked eye. So what I can appreciate with my naked eye, that's called macroscopic, and that's gross anatomy, gross. Now, when you have to learn about these same structures, but at cellular level, tissue level, that's called histology. When you have to now learn about how they are developed, that is their developments, especially within the human body, how it was developed while it's still in the womb, that's what we call embryology. So for today, our focus is really on gross anatomy, which I say is a study of the structure of the human body at a macroscopic level, which is what we can appreciate with what our naked eyes. Now, in the introductory part of anatomy, it's important we even know the regions of the body, the regions of the human body. We have the head, of course, this is the head, then the neck, then the entirety of this is called upper limbs. Upper limbs. So we have the upper limbs, then we have the thorax, what people will call chest, thorax. You have the abdomen, what they used to call in Nigeria here, belly. So the abdomen, so thorax, abdomen. Then beneath the abdomen, we have the pelvis, and then we have the lower limbs, which is what we usually call legs. All right, so but these are the right ways to call them: head, neck, thorax, upper limbs, abdomen, pelvis and perineum, then lower limbs. Of course, in the course of our learning, I'm going to introduce a lot of this and make it very clear to you. But for today, our concern is having the basic foundations that will help make your ride very easy. So let's start. What must we know? Number one, we should have a clear idea of what anatomical position is, anatomical positions. Now, when I'm lying with my head, when you lie with your head facing up, this way, with your hand this way, this position is called supine position. Lying down this way, this is called supine position. But if I turn and lie this way, that's called prone position. So there are two positions recognized in anatomy: supine and prone. And what we regard as the right position, especially when we talk, most of the times we talk about supine position. That's you lying facing up with your face facing the ceiling. That's supine. Whereas the opposite will be prone position. The next thing that's important will be anatomical planes. What should you know about anatomical plane that is important? There are different planes we can view the human body from. Basically, I'll broadly divide it into two planes: vertical and horizontal. For the vertical planes, we have three of them. We have our median plane, we have our sagittal plane, and then we have our frontal plane. Frontal is also called coronal plane. All right, so very quickly, let's see what this looks like. If this was a human body, please forgive my diagrams. But if this was a human body, yeah. The vertical, you know what vertical is now? Vertical is the long axis. So the plane that divides the person into two equal halves. So this plane here that divides me into two equal halves is what we call the median plane. It's a vertical plane dividing the human body into two equal halves. That's the median plane. Any other vertical plane still perpendicular to that median plane, but not in the midline. So if I divide myself here, that's median plane. But if I divide here, any place but the same way, but it's at any other instance, please, that is what we call sagittal plane. So median plane is in the midline. Sagittal plane would just be something that would have looked like median plane, but on other parts. So you could just say that median plane is just the sagittal plane we have in the midline. So that is that. Frontal plane is when you cut this way, still in the vertical line. But when I cut, you can now appreciate that. Imagine taking out my face and seeing beneath it. So this is important. Planes are important because of views. When you look at your anatomy textbook or you look at an atlas of anatomy, you get to realize that they paint some pictures, they give you some pictures. You need to know and appreciate the plane so that you know what you are looking at. So please, median plane is this, it's vertical. Sagittal is anyway still the same way as median, but not in the midline. Then frontal is still vertical, but then is in this plane, making you see from front. Now, we have a horizontal plane, which of course is only one plane. We also call it transverse plane. Transverse plane. So that is that for that. That covers planes. The next thing will now be terms of relation or comparison. So please, it's important to know when I mention comparison or relations, this is when I'm trying to compare one person with another, one part of the body with another. So these are not people standing on their own. So for example, I'm going to be using different terms. Let's start with the very basic ones, medial and lateral. This is important to know as a student. You must know what is medial, what is lateral. When I compare two structures, the structure that is closer to the midline is called medial. So if I'm relating two structures, I would say that, okay, let's assume I'm dealing with using the breast and the upper limb or the arm in this case. I would say that the breast is closer to the midline. So what would I say? That the breast is medial, whereas the upper limb is what? Lateral. So the one that is closer to the midline is regarded as medial. The one farther away from midline is regarded as lateral. So that's the difference between medial and lateral. But understand something, it only comes in when you are comparing two things. The next one I would like to talk about is anterior, also called ventral, and posterior, also called dorsal. So now, the front, if I have two structures, anything in front is regarded as anterior. So I can say this is your anterior part. This is the anterior part of your body. It is in front. This will be the posterior. Anterior is also called ventral. Posterior is also called dorsal. So anterior is ventral. Posterior is dorsal. That's the second one I would like us to differentiate. The next one I would like us to differentiate is superior, also called cranial, and inferior, also called caudal. Now, superior is anything, or cranial. Cranium is a Latin word for head. So anything closer to the head is called superior or cranial. Anything closer to your tail is called inferior or caudal. So that means if I'm comparing two structures like your mouth and your eyes, I would say that the eye is superior to the mouth. Or another way I could say is that the mouth is inferior. I could say the eye is cranial to the mouth. I'm correct. So anything closer to the head, that's the idea of superior. Anything farther away from the head, that's inferior. Now, another one I would like to bring in is proximal and distal. And please, you have to listen to this one well, because a lot of people are confused about how to use this term, proximal and distal. Proximal is when you are closer to the site of origin. Distal is when you are farther away from the site of origin. And if we are using the human body, we believe that this is the main part of the human body, the trunk. So the appendages, that is the limbs, are attached to the trunk. So anything closer to the trunk will be regarded as proximal. So if I'm using my upper limb, for example, the arm will be proximal to the forearm. Forgive me if you don't know what that means. This is proximal to this. This is proximal to this. At the same time, if I'm dealing with the arm alone, this part of the arm is proximal to this part. So that's what we mean by proximality. Proximality is just the idea of closer to where it originated from. So this concept will even help you when you get to muscles. That origins of muscles are proximal attachments, but their insertions are regarded as distal attachments. So proximal is closer to origin, distal is far away from origin. Some books would say proximal is closer to our trunk, whereas distal is far away from trunk. That is axial skeleton. All right, so we go forward. Other words we can see, quite these are not very common. You can talk of superficial. Okay, I could break that one in. Something that is superficial and deep. So in between superficial and deep, you should have intermediate. But you can have superficial, then you go inside. As you keep going inside, that's when you have deep. Superficial will mean closer to the surface. Deep will mean it is farther away from the surface. So those are the common ones you'll be seeing a lot as you are going to be dealing with this wonderful course called anatomy. Now, the next thing would now be terms of laterality. Terms of laterality. Now, there are 4 terms we have for laterality, which I would like you to take note of. The first one I would like to compare is unilateral and bilateral. If we are using the basic knowledge of English, uni means 1, bi means 2. So please take note, whenever you are comparing unilateral and bilateral, you are trying to deal with one structure. Please listen very carefully, the same structure. So I'm going to give you an example. The heart is unilateral. What do I mean? That the heart is only found on one side of the body, which in this case is on the left. But I can say the lungs is bilateral. What do I mean? I have the lungs both on the right and left side. The kidneys are bilateral, right and left. So whenever I say structure is unilateral, it means that that structure is found only on one side of the body. The liver is unilateral, found only on the right. The eyes are bilateral. They are found both on left and right. The mouth is unilateral. Okay, somehow, it's not really any way. But whenever I'm saying structure is unilateral, it means it's found only on one side. When I say it's bilateral, what do I mean? Yes, you got it right. That structure is found on both sides. Now, there's another one apart from unilateral and bilateral. This one is called ipsilateral versus contralateral. What do these words mean? Ipsilateral, please listen. This is when you are comparing 2 different structures. Ipsilateral is when 2 different structures are found on the same side. An example will be the heart and the left kidney or left lungs. So I would say that the heart and the left lungs are found on the left hand side, and that is correct. I can say that they are ipsilateral. Why? Listen. Ipsilateral, ipsi means same side. So when 2 different structures are found on the same side of the body, the eye and the heart, the left eye and the heart are found on the same side. I'm very correct. That is ipsilateral. But when we say something is contralateral, you are comparing 2 different structures found on opposite sides. The heart and the liver. Remember, the liver is on which side of the body? The right. If you don't know, please know it. The liver is on the right, but the spleen is on the left. So I can say that the spleen and the liver are contralateral. Contralateral means 2 structures on opposite sides. So please, I repeat myself. Unilateral is when a single structure is found only on one side of the body. A structure found on only one side of the body, unilateral. But if I have a structure on both sides, bilateral. The idea of ipsi and contralateral is when you are comparing 2 different structures. If they are found on the same side, there is 2 different structures on the same side, ipsi. 2 different structures on opposite side, contralateral. All right, so that is that for that. The last thing would now be the terms of movement. What are the terms we use when we talk about movement in anatomy? Because you are going to be hearing this a lot in gross anatomy. We have different movements. We have, let me compare them. We have flexion and extension as the first movement I would like to mention. Whenever we mention flexion, what is flexion? Flexion is when you reduce the angle at a particular joint. For example, the elbow. This is flexion. This is extension. This is flexion. So you are decreasing the angle at these joints. That's flexion. When you increase the angle or return it back to normal, that's extension. So extension, you increase the angle. Flexion, decrease. Now, another one we can have is abduction and adduction. So please observe the spelling ABD, ADD. ABD is when you move a particular part of the body away from the midline. So that is up. ABD, abduction. But when you bring it towards the midline, that is called adduction, like addition. So you are bringing it towards. So that is addition. Towards the midline, adduction. Away, abduction. So another term I would like us to be conversant with will be rotations. Not in all joints, not all joints that do rotations. So if I turn my limbs this way, okay, first, let's focus on this particular limb. I want to mention something first, pronation and supination. This is pronation, this is supination. The same idea as anatomical position earlier. So let's leave that. Pronation, this is a supine state, this is a pronated state for the forearm. Then for rotation, as you are turning, this medial rotation, lateral rotation. Then this other one where we move our hand like this is called circumduction. Circumduction. All right, so that is all I would like you to really know for the introduction to gross anatomy. Now, when we speak gross anatomy, we are dealing with the study of the human, the structures of the human body at macroscopic level, which is what we can appreciate with our naked eyes. And we have two positions a human body can either be in supine or in pronated. Now, we mentioned anatomical planes, different planes we can view the human body. We have three vertical planes, the median plane, any other plane, this way called sagittal, and this one called frontal plane. Then we have the horizontal plane, that's when you're cutting this one. That's your horizontal or transverse plane. Now we went to relationships where we had to make mention of the fact that we have front is anterior or ventral, back is posterior. Also, away from midline, lateral, towards midline is called what? Medial. So remember, this was when you were comparing structures. Inferior is closer, inferior is down, superior is up. So superior is also cranial, inferior is also caudal. We had proximal and distal. Proximal is closer to origin, distal is away from origin. What other things should we know was now laterality, that we have unilateral, bilateral, we have ipsilateral, contralateral. Those are different terms. Uni is a structure found only on one side. Bi is a structure found on both sides. Ipsilateral means that two different structures are on the same side. Contralateral means that two different structures are on opposite sides. Then we now came into movements, having flexion, extension, having abduction, adduction, having supination, pronation, and then having circumduction. Then when I turn this way, medial rotation, lateral rotation. For fingers, some people still show, I think lower limb, we make mention of evasion and the likes. For now, this is all we should know. Thank you so much for joining us. I believe that this was really helpful to you that was struggling with gross anatomy. Thank you very much for joining us. Please do well to like this video, and if this video has helped you, ensure you comment and then share this video to as many people as possible. If you have any question, type it out in the comment section, and if you have a topic you would like us to discuss, please feel free to type out and we'll make videos for you. Thank you very much for joining us, and God bless you.